What are vital signs? Vital signs are objective measurements that are essential for the physiological functions of humans. The reason they utilize the word vital is because their measurement and assessment is essential and the critical first step for any evaluation. The degree of vital sign abnormalities may also predict patient health outcomes, return medical visits, and frequency of readmission to hospitals. And these are utilized for healthcare resources. Can you think of what some of our vital signs are? Some of our primary vital signs are things like blood pressure, pulse rate, respiration rate, and temperature. I know you guys have been exposed to vital signs in previous courses, so why are we spending the time to go over them again? Well, the biggest thing is practice makes perfect. It's really important that we can accurately measure vital signs, and it's a clinical skill that needs time and practice to refine. While you guys have had exposure to taking vital signs in the past, we want to make sure that you are continued to have confidence in those skills. Another thing with vital signs, and why we're doing it specifically in this class, is because we can look at them from that statistical lens. We can look at inter-rater versus intra-rater reliability. If you recall, inter-rater reliability is consistency between two or more independent judgments of the same performance made by two or more raters. So that would be two different people taking a vital sign on the same patient, basically at the same time or in quick succession. Intra-rater reliability is consistency in scoring when a rater scores the same test or performance two or more times. So intra-rater reliability would be the same clinician taking the blood pressure on the same patient twice. Okay. We always want to recheck if there's a profound or unexpected change or outcome. So if there's a lot of difference in our inter or intra-rater reliability, we should repeat the measurement. The biggest thing that we are utilizing, or why we're utilizing vital signs again, is because of something called skill decay, which is basically if we don't practice, we lose that skill. And at this point, you guys aren't taking blood pressure super regularly or things like pulse or respiration rates. The first vital sign that we're going to talk about is temperature. So body temperature is a variable which is complex as well as nonlinear and is affected by many sources of internal and external variables. What that means is there is some variability in everybody's temperature, and that variability can even happen amongst one individual through a variety of changes. Things like hormone changes can affect body temperature. Fighting an infection can impact body temperature. Your body temperature increases following exercise. So those are some of the things that can cause our body temperature to change. Our normal body temperature for a healthy adult is approximately 98.6 degrees Fahrenheit, but this can typically range from 97.7 to 99.5 degrees Fahrenheit. There's also some variability based on where you're taking the temperature or the assessment location, and we'll be talking about those coming up. We also have heard about fevers. So a fever is a clinical measurement of a body temperature of 100.4 or above. So even if you are somebody that usually runs at 97.7 and you're at 99.5, while that might be an elevated body temperature for you, it clinically is not classified as a fever unless you're at 100.4 or above. There are 5 main locations where we can take temperature, and you probably have experienced most of these. So the first is temporal, or the side of your head or your temple. We also have ear as a thermometer place, oral, underneath the tongue, axilla, or in the armpit, or rectal temperature. Rectal temperature is the most accurate. It is most commonly done in infants, but it is also done if you suspect somebody of having heat stroke. So rectal temperature does have its place. It's the most accurate, and that is really important if we're worried about somebody having a medical emergency of heat stroke. Heat stroke is when we have an extremely elevated body temperature, usually above 100.4, and at that point, if we continue to have a body temperature above 100.4, we can start having brain deficits. Our next vital sign is pulse rate. It's sometimes referred to as heart rate. This is measured in number of beats per minute. In addition, we can measure the quality of the heartbeat or the pulse. We can assess whether it is weak, faint, strong, bounding. Bounding is kind of like that ba-ba-ba-ba-ba-ba sound, that like almost pulsating sound. It feels different than a normal strong pulse. And then we can look at the quantity, which is the number of beats. We have a table on this slide that breaks down the average pulse rate for people in a variety of different ages. I would highly recommend being familiar with that chart. But in adolescents and adults, we expect a range between 60 and 100 beats per minute. If they have a faster heart rate or more than 100 beats per minute, that's considered tachycardia. Okay. A slower than normal heart rate or less than 60 beats per minute is bradycardia. Now, those ranges are for an adolescent or an adult. A child between the ages of 2 to 6, if they had a heart rate of 60, that would still be bradycardia because it's slower than what is appropriate for their age. Okay. Same with a child between 2 and 6, a heart rate faster than 120 would be tachycardia for them. So those terms are in reference to faster or slower, but it is dependent on age. When we're assessing pulse rate, we want to take it for 1 minute. All of our criteria is based off of number of beats per minute. So we either need to take the pulse for a full minute, counting all of the beats that occur within that 60-second timeline. There are some other ways. We also could take the pulse for 15 seconds, counting all of the beats that occur in that 15-second interval, and then multiply it by 4 to get an approximation. Or we could take it for 30 seconds, counting all of the beats, and then multiply it by 2. The most accurate is to take it for a consistent minute, but taking it for 15 or 30 seconds and multiplying by the correct multipliers is acceptable. We have 8 common pulse sites that we're going to be looking at. Those are the carotid, brachial, ulnar, radial, femoral, popliteal, posterior tibial, and dorsal pedal. And we're going to break those down on the coming slides. This graphic represents most of the common pulse locations. The one that is missing that we will be taking is the ulnar artery. Remember, when we are taking pulse, we want to use our index and our middle finger and apply light pressure over that artery so that we can feel the pulse. The femoral artery does require some additional pressure because it's in a deeper location. We never want to take pulse with our thumb because our thumb does have its own pulse, and so it will be inaccurate if you are taking somebody else's pulse with your thumb. We will be going through these pulse locations on the next few slides and how to find them. And then in the PowerPoint version, there is also an embedded video for each location that I highly recommend watching. Our first pulse that we're going to take is for the carotid artery. So that is in our neck. We want to palpate with our second and third fingers gently under the anterior border of the sternocleidomastoid muscle. So we can kind of see on this image where we want to take that pulse. Please watch this associated video in the PowerPoint or use this hyperlink. Next, we're going to take the brachial artery. This can be found in the cubital fossa or the crease in your elbow, and it's going to be just below the distal or lower edge of the biceps tendon. The associated video with this gives some additional tips and tricks to find the artery. Please watch this associated video in the PowerPoint or use the hyperlink. Next is our radial artery. This is one of the arteries within our wrist. This is one of the most commonly taken pulses after the carotid. So remember, our radial artery is going to be on the radial side or the thumb side of the wrist. We want to use our second and third fingers to palpate on the palmar aspect of the wrist closest to the thumb. Please watch the associated video or use the hyperlink. The next artery that we're going to look at is our ulnar artery. This one is also in our wrist. Both the radial and ulnar artery branch from the brachial artery. Our ulnar artery, though, is going to be more medial in anatomical position, or on the pinky side of the palmar aspect of our wrist. We're going to use the same technique to find it, but it is its own distinct pulse and blood vessel. Please watch this associated video in the PowerPoint or use the hyperlink. We're now going to move to the lower extremity. We have several pulses that we can assess there as well. We want to make sure we're assessing lower extremity pulses if there's any sort of lower extremity injury or blood compromise. The first one we're going to talk about is our femoral artery. Our femoral artery lies within our femoral triangle, but how we find this is we want to find our ASIS, or that hip bone that kind of steps out. You can either have the patient find their pubic tubercle, or you can just picture where it's located. We do not want you to palpate that. And then the femoral artery is going to be about halfway between those two spots. When our hip is abducted or out to the side a little bit and externally rotated, it makes it a little bit easier to find. And then we're going to apply to our second and third fingers just inferior or below the inguinal ligament within that femoral triangle. Now, the femoral artery is pretty deep, so sometimes you do need to give a fair amount of pressure in order to find it, but we should not be causing our patients harm. Please watch the associated video or use the hyperlink. The next lower extremity artery that we're going to talk about is the popliteal artery. This is found behind the knee in our popliteal fossa. So that's kind of that crease behind the knee. It's easiest found with the knee bent to about 45 degrees, and it's usually more easily palpated lower in that fossa or lower in that crease, as you can see the fingers in the top left animated picture. You're going to palpate that pulse the same way with your second and third fingers. Again, this one does lie a little bit deeper. Please watch the associated video or use the hyperlink. We have two different arteries that we can feel in the foot. There's going to be one video after the second one that demonstrates both. But the first is our posterior tibial artery. So this is located just posterior or behind our medial malleolus. So our medial malleolus is the inside kind of knobby ankle bone, and then it's going to be just behind that, as you can kind of see in this picture. And we're going to palpate that the same way. Our last pulse is our dorsal pedal artery, or pedis pulse. So this is on the top of our foot, and it's between our extensor hallucis and extensor digitorum longus tendon, kind of in line with the second and third toe of the midfoot. So we can see here. Please watch the associated video or use the hyperlink.